Pancreas cancer is currently the fourth leading cause of cancer-related deaths in the United States. A similar number of people that are diagnosed, about 36,000, and a similar number of deaths each year. The advances in pancreas cancer have largely been related to surgical advances and a better understanding of what may cause pancreas cancer, who to consider screening on, and also how to what we call sequence treatment. We used to think in terms of pancreas cancer as far as can the tumor be removed? If it can be removed, then go on to get chemotherapy. We now think of pancreas cancer, and that's the way we do it, in a completely multidisciplinary way. So we will have discussions with medical oncologists, with radiation doctors, with geneticists, because genetics plays a large role in pancreas cancer as well, to try and sequence treatment in a way that is most beneficial to the patient. The cause of pancreas cancer is similar to other gastrointestinal cancers. There's a higher incidence of pancreas cancer in patients that are obese. There's a higher incidence in diabetics and smokers. And there's also a relationship between what we eat and pancreas cancer. I think that it may well be preventable, but again, we have to think in terms of what age do you start paying attention to what you're putting in your body, and to the importance of exercise, and to the importance of weight loss, because that may all result in a reduction in the incidence of pancreas cancer. You know, the first thing people think of, the first thing they do when they hear the word pancreas cancer is they go online and they do this Google search and they get themselves into a very dark place. And so I really caution people against doing that for several reasons. Number one, they may not have pancreas cancer. It's not uncommon these days that someone gets a scan for another reason and then a cyst or a nodule is seen in the pancreas, and they're sent to us because the doctor thinks that they may have pancreas cancer when in fact it's completely benign. And that person's already gone down this very dark hole looking up all the things that can happen to you with pancreas cancer. Having said that, if you have cancer and it's in the head of the pancreas, the operation that is typically performed is called a Whipple procedure, or a pancreatic duodenectomy. That operation is done by surgeons that do it routinely because it is a complex operation, but it is also a safe operation. And so we spend a lot of time just walking our patients through the operation. And now we've embraced what we call enhanced recovery pathways. We started off using them for colon cancer, but now we're using them for all gastrointestinal cancer and pancreas cancer. And I think what we found with these enhanced recovery pathways, which really translates to getting up and about more quickly, get the people back to a normal life as quickly as possible, has really changed the way we approach complex operations for the better. And I think we've come a long way in diagnosing pancreas cancer, treating pancreas cancer, and there is some optimism that we not only have more effective chemotherapy drugs, but there are some targets that are being found in the pancreas, and particularly something called KRAS, that some groups are now developing vaccines against. So the field of pancreas cancer, the biology, there is some sense of optimism that we're going to make some breakthroughs in the next few years, which I think is very important because the death rates are so high, particularly in those people that present with advanced pancreas cancer. And the symptoms can be very, very subtle, from a little bit of stomach pain, weight loss, to something more obvious such as jaundice because of the location of the tumor compressing the bile duct. But I cannot state it enough how important it is to let your doctor walk you through it rather than Google pancreas cancer and then try and come up with what you think you have and how you think you should be treated.